Good afternoon,
Good afternoon.
everybody. I am very grateful to the management of AMRI hospitals for inviting me to CME. I am a senior neurologist attached with Bellevue Clinic for the last 23 years, and I was associated with AMRI since 2000, almost 22 years. We had a team of doctors in AMRI, including Dr. R.S. Bhattacharya and others who are still in AMRI, but unfortunately I could not be in AMRI now because of my busy schedule. I am thankful to Dr. Datta for giving a very nice presentation and briefing us the various ailments and the cardiological disorders and what he has also very well appraised us about hypertension, myocardial infarct, ischemic heart disease, etc., etc. Now, to commence with, I should say that cardiology and neurology are very close subjects because hypertension is the primary cause of stroke. You can say a CV or a hemorrhage or a intracellular hemorrhage. Hypertension is the primary cause of brain stroke. I will try to keep my words as simple as possible so that everybody can understand. So, cardiology and neurology, as I said, is a very close subject because in both the cases, treatment is done for hypertension as well as treatment is done for dyslipidemia, hyperlipidemia. Patient only suffers stroke when the systolic and diastolic blood pressure is above 140/90 and the triglyceride level is high. Of course, diabetes is also a very common factor, but especially hypertension. Now, one thing during Dr. Datta's speech, I was listening and I noticed that statin with fenofibrate. So here I should say, fenofibrate should be administered to patients who are obese, overweight. Am I right, Dr.
We cardiologists generally, sir, do not recommend fenofibrate until
we also don't recommend fenofibrate. Whereas as far as statin is concerned, according to World Health Organization guideline, patient above the age of 40 years should be administered statin. Am I right?
Yes. And if the patient is diabetic, you should not forget to write a statin.
Yes.
Statin patient
statin
sugar,
is
अपनी HbA1c 6.40%, that means he is a pre-diabetic. Diabetes হচ্ছে, আপনি যদি statin না দেন, you will end up in kidney disease বা heart attack. So statin is the most important therapy যেটা heart attack.
Statin is mandatory with patient with known case of hypertension above the age of 40 years. That is in my day-to-day practice. Now we come to the main point, the very common, like you see, there are various neurological disorders. The first, as I said, is brain stroke. The second is epilepsy or seizure disorder, where patient suffers from convulsion. Then there are Parkinson's disease, Alzheimer's disease, dementia. But to cut short, I would speak only about the cerebral strokes, which is very common. Now, first we have to, when the patient comes to you, first you have to see the symptom. What is the symptom that the patient has come to you? Number one. you will have to see that whichever side of the limb, is there any kind of weakness? You should check the plantar, that if there is any kind of weakness in upper or lower limbs. That is number one. Number two, slurring of speech, kothar jorota. That is a very common cause, symptom. Number three, dementia. I had breakfast in the morning, but I don't remember during lunch that what breakfast I had. So that could be a cause of stroke. Vision dimness, choke chhapsa dekha. Now, how you would diagnose that this is a case of hemiparesis or hemiplegia, or hemorrhage is totally different, because in case of hemorrhage, you see, you cannot treat the patient in the chamber. But primarily, you are the doctors whom the patient visits first, and you justify that this patient should be referred to a neurologist or not, or the primary treatment that will be done by you is good enough. That depends on the severity of the symptom. So, number one, you will have to see whether the plantar, is there any weakness in the upper and lower limbs? And then number two, there is slurring of speech. Number three, vision dimness. Number four, dementia, whether patient is remembering, recognizing everything or not. Now, if the patient comes with these symptoms, what are the investigations required? The first and the most